Hi, this is Robbie. He's my patient for today. So first I'm going to test your level of alertness, Robbie.
Okay.
So what day of the week is it?
Monday.
Right. What's the weather like outside?
It was kind of rainy today.
Right, okay. What's the date today?
It's March 19th, 2018.
Awesome. Okay, so he is aware. He's aware of all the questions I'm asking him, so that's good because that means he is aware of his surroundings. He doesn't have any dementia. If food were presented to him, he would be aware of it. You wouldn't have to try to make him aware of the fact that he was about to be eating. I also have to test your auditory comprehension. So touch your nose, touch your eyes, then your ears. Awesome. Okay, and that's important because if you have to give a patient directions for eating, it's important that they be able to understand them. Okay, next I've just been observing his breathing at rest, and he breathes through his nose, not through his mouth, which is good because that means he won't have any issues breathing while he's eating. He won't be trying to open his mouth and breathe while he's eating and be losing the bolus. He does not have a trach or anything, so you don't have to worry about feeding through a trach. Next, I will kind of go into the cranial nerve assessment. So the first cranial nerve is cranial nerve 5. So to assess that, I have to do jaw opening and closing. So open your mouth, close your mouth. Okay, so he doesn't have any limited opening, which means he should be able to get the whole bolus into his mouth, and he doesn't have any problems closing, which means that provided he can maintain a labial seal, he shouldn't have any problems keeping the bolus in his mouth. Okay, so for cranial nerve 7, his facial muscles at rest are not asymmetrical, they're symmetrical. There isn't anything wrong with them, like as far as fasciculations. So I'm gonna have you pucker your lips. Right, now smile. All right, now I'm gonna have you keep your lips closed against resistance. So I'm gonna push at your lips and don't let me open them. Awesome. So his lips being closed and me being able to apply resistance and he being able to keep them closed is good because that means the bolus won't come out of his mouth if there is pressure against it. I'm also going to have you puff air in your cheeks, and I'm going to try to puff up air in your cheeks. And I'm going to try to push the air out, and do not let me push your mouth open. Okay, awesome. So that's good because the bolus, is on the inside, so nothing pushing outward is going to be able to get out if you can maintain that seal. Okay, so next I'm going to test cranial nerves 9 and 10. So I'm going to have you go, ah.
Ah.
Okay, so there are no problems with voice. Now I'm going to have you stick your tongue out. Now go, ah, 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 ah.
Ah, 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 ah.
Awesome, so there's no problems with this velum going up and down, which means that there shouldn't be any problems with velopharyngeal closure or anything like that because his velum is able to move normally. I'm going to have you cough for me. Okay, he's able to voluntarily cough, which is good because if he were to begin to aspirate or get any food stuck in his throat, he can voluntarily cough it up. Okay, stick your tongue out. Awesome, keep your tongue out. Okay, I tested his gag reflex. It's good that he has a gag reflex because if something were to go to the back of his mouth, if the bolus were to go to the back of his mouth and wasn't properly chewed yet or something, he has the reflex to be able to keep himself from choking on it. Okay, and then I'm gonna have you swallow. Okay, and he's able to dry swallow, which means that like his swallowing mechanism is fine for swallowing. Okay, so next for cranial nerve 12, I'm going to test your tongue's range of motion. So stick your tongue out, lift it up, lift it down, go from side to side. Okay, so the tongue range of motion is good, which is good for manipulating the bolus, keeping it medially on the tongue, being able to get any food out of the lateral sulci if it falls in there. Okay, next I'm going to do your tongue strength. So stick your tongue out. Now push up against this. Awesome. Now stick your tongue out, push down. Now push to the side and to the other side. Awesome. So he's able to apply pressure with his tongue, which again is good for formation of the bolus, and it's also good for creating pressure to be able to propel the bolus to the back of the mouth, which means that none of the bolus should get stuck in the oral cavity when he's trying to swallow it. I also did not note any atrophy or fasciculations of his tongue. Okay, so next I'm just going to examine your oral cavity. So open your mouth, stick out your tongue. Okay, everything in there is a nice pinkish white color. There's no scarring or lesions or anything. So there shouldn't be anything in the way of the bolus or getting in the way structurally of swallowing the bolus. His dentition is fine. His teeth are all normal. He's not missing any teeth. None of his teeth are in the wrong place that would make it hard for him to be able to chew. Okay, so now to do test swallows. He already did a dry swallow, so we're going to try it with some water. Alright, and now we're going to try with a thicker liquid, almost pudding-like consistency. We have applesauce. And testing with different consistencies is good because it just tests his ability to manipulate different consistencies of boluses and to be able to maintain a labial seal and maintain his ability to swallow the whole bolus no matter what type it is. So when he swallows this, I'm going to palpate to feel the oral transit time. Okay, that was within 1 second. So from the time that he swallowed to his hyolaryngeal excursion was about 1 second, which is good because that means that he's not really having any trouble swallowing. There wasn't really any tongue thrust present. The limitation with that is you cannot really be sure exactly what the oral transit time was or exactly when the swallow occurred because there was no imaging and you can't see inside the mouth in the back of the tongue. His respiration was fine. He did the exhale, swallow, exhale respiration pattern. Because his respiration was noted as fine earlier, the period of apnea shouldn't be an issue for him. He is able to self-feed, so he doesn't have to have somebody feed for him. I think the last thing we have to do is the aspiration test. So we're going to do that with the 3-ounce water test. So he's going to swallow. I'm going to check for aspiration. Okay, so no aspiration was noted. He did not. And the way to know aspiration at bedside would be to know whether there was coughing or not, basically. And the limitation of that is that some people can silently aspirate where they just don't cough, and that usually is because they don't, sensorily, they are not aware of the aspiration. So the problem with doing a bedside evaluation for aspiration is that without imaging, you're not really going to truly know if they've aspirated because there are other factors that could influence if they've aspirated or not, and you just can't really check for all of those by just looking at a person. It's also really hard to determine like a diet recommendation without some kind of imaging to see exactly how each consistency is doing in their throat, to see what pocketing occurs, to see if the bolus needs to be swallowed more than once. So I think that's it.